I'm Craig Garfinkel, and I direct the training at California Pacific Medical Center. We have a integrative therapy practicum training, and we're a medical center that has three sites in San Francisco. We work on um, adult inpatient units throughout the hospital. So really anybody who's over the age of 18 who is in the hospital, and we work probably on about um, 9 or 10 different units at this point. So it's quite diverse, the population. I sometimes say it's people with bodies where something's happened to their bodies. So, and then our philosophy is that really the hospital is our patient. So it's not just the folks who are in the gowns, but also their families, their loved ones, their caregivers, the staff also. Um, so we really try to have kind of a systems approach and are, yeah, treating not just the patients, but their care system as well. And there's tremendous diversity in our population in the ways that you usually think about diversity, but also in lots of other ways. So I think we're one of the few sites where there may be like a CEO in one room and somebody who's homeless in the next room. We work with a lot of patients who are monolingual in other languages. So we really welcome folks with bilingual skills and can put that to work and use also. So we treat everybody who comes into the hospital, into those units. So we just try to work across whatever barriers there are. Um, all kinds of diversity on cognitive levels, folks that are really, quite high functioning and others who aren't. Sensory levels, levels of functioning in the body also as well. So physical disabilities as well. Yeah. We work quite collaboratively as a team. So we have actually three cohorts at our three sites. They're each 6 to 8 trainees. And we are one of the disciplines that works in a larger multidisciplinary care team with doctors, nurses, physical therapists, case managers. Um, there are chaplains, nutritionists. So this very kind of holistic health team. And then our team is really, what our expertise is really managing kind of like the psychological side of the hospitalization. Um, so in terms of duties, there's a lot of direct clinical work where we're really meeting with patients, meeting with their families, sitting at the nursing station and supporting the staff who might have a challenging relationship with some of the patients. Most of the work that the trainees are doing is really is direct client work, as I said. I think there's a whole aspect of our training that I guess I'll go into a little later around just really treating the whole experience there as a kind of active meditation for the trainees themselves. So really becoming aware of what's happening for them moment to moment in the hospital. Um, because as I said, we treat the hospital as our patients. So it's like the way that we're showing up with the staff is really important also. Um, and yeah, and even if we're not directly doing therapy, it's I think we have a presence in the environment that we're holding some of the principles that we hold as therapists. And so referrals sometimes come from the team. So we attend like rounds where the multidisciplinary team talks about patients, and they might say, oh, this patient is really isolated, or this patient is really anxious, or this patient is really kind of squaring off against staff. They may not be compliant with their treatment. So sometimes we get referrals from staff. On some units, we do daily visits. We try to do daily visits with everybody who's on the unit. So we'll have our own huddles at the beginning of the day, where there might be 2 or 3 trainees working together, and they'll kind of divide up the patients. It's kind of like their own practice. So they kind of triage and divide up patients. It might be that a trainee has worked with a patient before, so they'll take that patient. Some of what we co-treat, and we sometimes different trainees will see the same patient. It gets quite interesting because sometimes they have different transferences to each of us. So we work very collaboratively and really try to assess what each patient may be needing. I think that one thing that's particular about our site is that it's a brief therapy model. We're working really with people who are in crisis in the hospital. Some patients we just see once. They're about to be discharged. There's always something that brought them to the hospital. They're having an experience in the hospital, and they're always going to another place. So our idea with assessing is we teach our trainees how to really quickly show up and assess to what somebody is needing and what can be done in a brief amount of time. I don't know if you've ever had this experience, but somebody shows up in your life just kind of at the right time. You only see them once, but they say the right words. Somehow they were able to intuit what the right words were, and it really stays with you. That's the kind of training that we're kind of teaching in the hospital, because folks really are in crisis. So we're really we train our students how to quickly assess, quickly try to figure out some kind of creative way to come around that and support the patient, kind of figure out where their suffering lies and how to support them in that, and also how to reassess. Because it might be where we pull up a chair, we're by the bedside, and a nurse comes in to do a blood draw. So we have to like sort of work that in and yeah, kind of sort of switch gears in a hurry. One more thing that I wanted to say is that I think what's kind of unique about our site is that we don't have a frame for psychotherapy. And what I mean by that is most sites have a room where you do psychotherapy and schedule times to do psychotherapy and people who are there for psychotherapy. And we actually don't have any of that. We have a lot of people who are in a medical crisis, where something has happened, and they really benefit from somebody showing up as a hospital therapist. But I think a lot of the training is how to quickly pull up a chair in, if you think about it, it's like a stranger's, not even living room, but bedroom. So you're going into somebody's hospital room. It's really their bedroom. They're in a gown, and they don't know us and we don't know them. But we do know that we have skills as to be able to support somebody in their suffering. So to find creative ways to make a conversation and to really find what could be a frame for psychotherapy, and to try to actually create that for them. So it's a particular kind of assessment skill that you get at our site that's, I think, very different. So because it's inpatient, you don't have to build up a caseload. And from the very first week, you get really a maximum accrual of hours. So it can be 10, it's usually 10 to 14. And we're supporting 10 hours on site through the supervision. And then sometimes as an offsite supervisor that can support additional hours. So it's one of the really cool things about our site is that you don't have to work up a caseload, which I think other sites can sometimes be problematic. And yeah, that can take some time. And then the other thing that's, I think, kind of interesting about our site is that you work with lots of different patients over the course of the year, probably over 100 patients that you're seeing. And so you learn how, again, like sort of how to quickly assess and treat, and termination. Actually, we talk about termination from the very first week because it's happening throughout the year. So it's not like, oh, we get to the the end of the year and then we're dealing with that. And the idea is really how to leverage being a short-term training site. So I think we really get lots of skills in how to assess. And arguably, thinking about termination from the very beginning, it can potentiate the therapy. If we only having one time together, we want to really sort of like wrap a bow up at the end and integrate, and what are the learnings and what the next steps are, and how to provide a continuum of care to the next place where somebody is going to, and how to resource them. We have a group supervision that I co-lead. We actually have 3 different cohorts. So we have 3 2-hour group supervisions, and I co-lead them with one of our 3 supervisors. 2 of those supervisors, incidentally, are alums from the somatics program at CIS. And then the individual supervision is with that supervisor, so with one of those 3 supervisors. So there's a 2-hour group and a 1-hour individual supervision. And then there's a fair amount of, I would say, sort of mentoring and peer counseling as well. Like, we're learning from each other. And as I said, we don't have these separate counseling rooms. So everybody is really working in the milieu. And yeah, so I think there's a fair amount of like kind of learning from each other and from the cohort. So the name of our training is the Integrative Therapy Training Program. And integrative therapy is weaving together some different things. So the first is kind of behind me. I don't know if you can read that, but it's expressive arts and somatics and transpersonal. We realize that there are all these really cool academic trainings in the Bay Area, but we sought to be a site that really put that together in terms of clinical work. Somatics, I think, is kind of obvious. We're working in a hospital. We're always working with the body, and we're always thinking about sort of the mind-body connection and how the psychology of being embodied. Transpersonal is because I think the hospital brings issues of life and death, and it brings a lot of loss up. And so sort of we think about what our patients believe in, what their faith objects are, what gets them through difficult times. We work a lot with the idea of bringing resiliency. We have this idea that the hospital doesn't just have to be this kind of, bummer of a place where they have to be, but can actually offer a time when they're reflecting on their life, a little bit of a timeout or a retreat, and could potentially offer the idea of a transformative rite of passage for them. So that's kind of the idea in the work, is really understanding what the patient's worldview is, what their symbology are, what might be a potent healing symbol for them. And then we use the arts because the arts are safe, but they go deep. So some of the things that you might see behind me is like, we'll help a patient to draw a mandala and then put it up in their room, or prayer flags, or sometimes the interns, we make cards for our patients. and we gift them with that. Or we might come out of the room and out of a conversation we just had, and there's a line from a poem that really is with us, and we might put that on a card with an image. Or they might have said they love just walking in the forest. We'll ask folks, what are the places in nature that really, rejuvenate them, and try to bring that, because the hospital environment can be kind of sort of institutionalized. So we're trying to bring their imaginations out of there, and the arts are a great way to do that. We're also integrating different orientations to psychology. So if you had a video camera on our bedside work, you would say, oh, it's quite relational and humanistic. They're working, we're trying to really create a positive transference and be the part of the care team that really understands the patient. And so you would say it's really humanistic. But then if you came to our group supervision, you would say, oh, wow, they're working quite psychodynamically. And we work psychodynamically because that offers a large frame for kind of understanding the invisible things that are happening, we want to really understand the patient so that we can know how to treat them. So we're very, I would say, object relations and archetypal, like Jungian psychology, are big focuses of ours. And then some of our patients are in pain. They're like some are in excruciating physical pain. So we're really working, what's most useful there is CBT. So for pain management, a fair amount of our patients are suffering from substance abuse issues that have gone awry and landed them in the hospital. We just started working on a transplant unit. So these are might be folks that were drinking, developed cirrhosis, and now have a liver transplant. So we're able to talk with them about, during that time, and use some motivational interviewing. So we really trying to weave together CBT with humanistic and psychodynamic as well. I would say there's quite a bit of chaos and trauma in the hospital. And so the main thing that we really feel, helps for our trainees is having sort of an underlying emotional maturity. We all have our traumas that we've gone through, but how much work have we done on them? It really requires somebody who's kind of done their work to some degree. We require that all of our trainees are in personal psychotherapy throughout the training as well. And we provide a lot of support from the supervisory team. But I would say that, if somebody kind of hasn't done their work, then the trauma, being really in a trauma zone of the hospital and of illness and of life and death, that can really rattle some folks. It rattles everybody, but we really can come around it. So if there's that level of capacity and maturity, that really, that bodes well. And the other thing that I would say is a sense of service. It doesn't always look like the kind of counseling or psychotherapy that we may have imagined or been taught in school. Sometimes we're helping our patients with very practical issues, like getting them a warm blanket or something like that. So it really, I think, our trainees that really sort of have, a deep sense of service, I think it really, it goes a long way. We're working with a lot of people who would not really probably on their own go for psychotherapy. And, I think it's really, it's a privilege in some way to be able to show up for the patients in this way. And it's almost like a spiritual practice in some way, to be able to just show up with real kindness and real compassion for folks that are in kind of a compromised situation. Yeah. So I was speaking about, spoke about a few things. I spoke about that, the hospital can be a very complex, chaotic environment. I think it's an excellent training site because you learn a lot about systems, and you learn a lot because you're also placed in a lot of unusual clinical situations every day. Literally dozens of unusual clinical situations that your school program could not have possibly prepared you for. Um, and so that can cause something kind of decentering. And we feel that that's actually where the learning happens because you have to find a way to kind of show up. And we are, I would say, a capacities-based training site, which means that, I don't know if you can see these things. Things like empathy and playfulness and authenticity, having the courage to say the right things, being aware of our own countertransference. So I think that these things develop over the course of the year, but in the beginning, that can be a struggle for some of our trainees who are just being hit with a lot of things. We talk about kind of an asteroid belt that you have to sort of get through, and then there's clear space on the other side. So other things that I think, I think sometimes, even though everybody understands that we're a brief therapy site, in the beginning, that can be a little bit tough when you see your classmates that are having these nice longer arcs to their psychotherapy and developing a process. But invariably, by the end of the year, I would say our trainees really come to value this idea of it just becomes second nature to be able to assess somebody really quickly. And you get so many different times of terminating that really life is all about hellos and goodbyes. And so you just get a lot of muscle in working those areas. But sort of before you have a frame for psychotherapy yourself, that can be a little bit difficult in that process. There's one more aspect of our training that I think we're really excited about that we've shifted over the years into, but this year we've kind of really owned it, is that it's, you know, no pun intended, painfully obvious to us as people who work in a hospital, that we ourselves are really wounded healers. And there's a sense that if we are too over-identified with being the healer, we force the other into taking the wounded role. And this is sometimes what can happen in medical systems in the hospital. When we can own sort of our own woundedness as wounded healers, it paradoxically allows a space for the people we're working with to contact their own inner healer. And so that's really our model that we are really stepping into this year. One of our supervisors, Beth Bremer, is a certified mindfulness teacher. And so we have formalized that mindfulness component of our training. And we really feel very strongly about making a platform of self-care. So it's not just about like paying lip service to self-care and, oh, you got to take care of yourself. It's almost like our ethical platform as wounded healers is to really learn how to take care of ourselves and work with our own child parts inside and sort of grow that wise woman. That's what we call this one, who is kind of the adult in us, that really we learn how to hear her voice. And that's what moves us as therapists when when we're showing up with patients. So we bring that mindfulness practice in weekly when we're in a group. And we've also paired off our trainees in dyads. So they're doing co-counseling with each other. So they're supporting each other's practice. And then all of the trainees this year are doing a daily mindfulness practice on their own that we're supporting. And we really feel like that's the basis for learning how to become a therapist. So that's something that we're really excited about.